Fake news, fake news, fake news. You've probably heard that term before, and it's no more relevant than right now. At a time like this, where we've got the coronavirus outbreak, we can see, and I think we have seen, a spike in the number of civilian bloggers, conspiracy theorists, armchair commentators online, all giving public health safety warnings about coronavirus. At a time like this, there is so much misinformation out there that now what's coming to bear is the importance of authentic voices, who we can actually go to find out what's going on. One thing I hear all the time when we speak to people, whether it be on the streets, but equally on social media, and I ask them, how do you feel about coronavirus? Or maybe we ask them on our Instagram page. What people often say is, no clue what's going on. I'm just confused. What do I listen to? Is it 10 weeks away? I heard today it's going to take us 18 months till we're back, to a period of normalcy. Someone told me before it's going to be maybe a month. I mean, that's a big difference there, right? So with all this news out there, what should you do? How should you approach what's happening? Well, I think there are some trusted voices you've got to go to. Number one, I wouldn't believe what your friends say. I know you love them and they're sincere and they're genuine, but sometimes they're quite frankly genuinely wrong and they're sincerely wrong. And what we've got to do is, rather than listen to friends and family who've got folk tales I remember talking about the diagnosis of somebody. They had a blocked nose, they had a fever, and I said, have you got tested, have you looked at the symptoms? They're like, nah, I won't have it. I was like, well, how do you know that? And they kind of said, well, I just want to have it. And I thought, well, that's kind of not how it works. Viruses don't go, oh, that's a confident guy, so let's not infect him. You've got to not just go on how you feel or what you've been told or what your mum's told you, and you've got to look at trusted voices. Now, what are these trusted voices? One is obviously Public Health England. Now, they give daily updates pretty much on what's happening, and what to be aware of, and how to make sure you're deciphering between a common cold and a flu, and what's happening here. Another thing, I was listening to a doctor on LBC say this actually, and he said, everyone's talking about the coronavirus, but and he was saying it kind of a bit frustrated. He said, well, you must know that other things are happening as well as the coronavirus, as in like all illnesses haven't stopped or paused because of the coronavirus. So he literally said that same day he might be called out to attend to someone who has kidney failure, someone who's been diagnosed with cancer, because that's still happening. What's happening with the coronavirus is the coronavirus has been added to the list of different viruses and diseases that people can get, but there's lots of other things going on. So Public Health England was such a good place to go on to find out just what's happening with public health in England. How would you figure? Other trusted voices are, of course, the World Health Organization. If you're looking for global stats or kind of global standings and how the world is doing generally, that's a good place to go. For the next 8 days or so, we know that Prime Minister Boris Johnson is going to be given daily briefings on how we're responding to it, what's going on, what the numbers of infections are. But equally, you might get Rishi Sunak and the chief scientific advisor, and different epidemiologists all giving their thoughts on what's happening. I think times like this, we've got to reject the fake news and the misinformation that we get online. I'm going to do some digging ourselves to find out these authentic voices and to try and understand what's actually happening. I think that might calm some of our nerves, but also remove some of our anxieties, and also make sure we're not peddling misinformation, which sometimes we do unknowingly. Remember, to find out more information like this, TCS Network, .co.uk/join.